So we have had this statement literally in the last few minutes, which says, following further evaluation this morning, the Queen's doctors are concerned for Her Majesty's health and have recommended that she remain under medical supervision. The Queen remains comfortable and at Balmoral. So I think it's worth reading through that again. They have said that following further evaluation this morning, the Queen's doctors are concerned about Her Majesty's health and have recommended that she remain under medical supervision. The Queen remains comfortable and at Balmoral. Now, I also understand that her immediate family members have been informed that the doctors have made this decision, that they have given the Queen this advice. I also understand that there has been some speculation that there may well have been some kind of a fall. The Queen may have fallen, but I understand that is incorrect. And also, I think they are very keen that there is no further speculation. Of course, there undoubtedly is going to be concern about the Queen. It was only last night at 6 o'clock that we were informed by Buckingham Palace that the Queen had to pull out of conducting a Privy Council meeting, which had been penciled in yesterday evening. Last night, they'd said that after a full day on Tuesday, Her Majesty had accepted the doctor's advice to rest, which had meant that a Privy Council meeting that she was due to be conducting, albeit remotely from Balmoral, wasn't able to go ahead. I think yesterday, certainly their hand was really forced to make that announcement. It is undoubtedly quite rare for them to give us any kind of updates when it comes to the Queen's health. But in terms of the Privy Council, of course, her new Prime Minister, Liz Truss, was due to be involved. Also, new members of the Cabinet, also during that Privy Council meeting, should have been sworn into that important body of advisors to the monarch. It would have appeared in the court circular, and therefore, if she had been unable to carry out that engagement, people would have asked questions. So yesterday really was the first time that we heard these concerns from the medical household, because you have to remember that there will be medical people with the Queen at the moment, no doubt. She is now 96 years old, and in some ways they are probably just as important when it comes to advising her as her principal private secretary. We have to remember, we're seeing the pictures now. Tuesday was a very busy day for Her Majesty the Queen, and she had been very clear with all of us and with her advisors that no, she wasn't able to make that trip down to London to carry that important constitutional duty of appointing a new Prime Minister, but she still wanted to do that in person. And so the plans had been put in place to make sure that everyone knew where they needed to go. And so you had her 14th Prime Minister, Boris Johnson, heading up to Balmoral to tender his resignation. And then we see those pictures there of the 96-year-old Queen welcoming her 15th Prime Minister. So just to confirm, in the last 10 minutes or so, we've had a statement from Buckingham Palace which has said that following further evaluation this morning, the Queen's doctors are concerned for Her Majesty's health and have recommended that she remains under medical supervision. The Queen remains comfortable and at Balmoral.